Hello, everyone. It is my pleasure to introduce Team GastroKnowMi. My name is Anthony, and I am a graduate student studying public health with previous experience in dietetics research. Shiv is a graduate student studying data science with a background in computer engineering. Carlos, the creator behind our solution, is a graduate student studying product design. And now we can meet Samir, who has been experiencing gas and bloating symptoms for a few months now. And after seeing a gastroenterologist, Samir went on elimination diets to identify symptom triggers. But Samir lives a busy life and cannot keep up with self-tracking his symptoms and his food triggers. To make things worse, he has also began experiencing discomfort after passing stool. With minimal support or guidance, Samir has started to become frustrated and confused. And these experiences are so common among patients with gut-brain interaction disorders, or DGBIs. DGBIs are a family of incurable chronic diseases that connect the gut to the brain. Think of diseases like inflammatory bowel disease or acid reflux. Each disorder involves a complex set of biological, psychological, and social interactions that influence disease development, which all tie into the uniqueness and variability of each person's disease, ultimately complicating the provider's ability to diagnose and support patients. The impact of DGBIs on people and the US healthcare system is quite evident, with 131 million Americans affected, totaling over $142 billion in care costs. We've even put faces to these statistics through Zoom interviews and survey responses. Patients told us they hate seeing their providers and feel burdened with monitoring their own symptoms. Providers told us that improving patient adherence is critical to treatment success, but difficult to realize. And researchers told us that existing solutions are too generalized and lack structure and guidance, which all tie into the core objectives. And those objectives for patients and people like Samir are to incrementally monitor, learn about, and track their digestive symptoms and to validate their assumptions with confidence to effectively manage their health. Now I will hand it over to my teammate, Carlos, to introduce our solution.
Thanks, Anthony. After years of struggling to manage my own digestive diseases, I developed GastroKnowMi, a gut health management program that uses self-experiment modules and personalized learning to help people develop the confidence, autonomy, and connection needed to effectively monitor symptoms and make informed health management decisions. GKM experiments are randomized single-subject trials that enable users to explore health inquiries by specifying treatment goals and outcomes that are meaningful to them. During setup, users are educated on nutritional, medical, and study design considerations, helping them to select appropriate experiment parameters, such as target symptoms, triggers, and treatment and control phases that will result in more robust cause and effect analysis. During an experiment, GKM collects user health and behavioral data from wearables and algorithmically delivered user prompts to understand whole person traits and provide culturally and symptom relevant insights. At the end of each experiment, users receive an outcomes and recommendations report that makes it easy for users to reflect, learn, and make decisions based on their experiences. With enough participants, GKM will aggregate data about the outcomes of certain experiment modules and provide users quick start experiment templates that allow them to assess potential benefits before committing to an experiment. In that same vein, GKM leverages community health data to personalize health recommendations that promote connection and belonging among users while preserving their privacy. Returning to Samir, after conducting 3 GKM experiments, he learned that his Ecuadorian upbringing and habit of eating food late at night might be causing his gas symptoms and that he should explore eating earlier in the evening and in smaller portions. Samir also learned from other community users that drinking wine in place of other alcohol could help reduce dehydration and colon pain symptoms. Many GKM competitors offer traditional monitoring and virtual care services, but few account for ease of use and personalization experiences that encourage users to manage symptoms and make decisions on their own. Current competitors don't account for social determinants of health, namely where and how people live, learn, work, and play. In order for health recommendations and insights to be effective, they need to account for how these social determinants influence individual health risks and outcomes. Likewise, competitors offer insufficient treatment guidance and in-depth behavioral and symptom analysis, often delegating these tasks to a provider or clinician. GastroKnowMi, in comparison, accounting for community features, culturally relevant insights, and a modular and intelligent approach to data collection and learning delivery outperform competitors. GastroKnowMi sizes its target market at $14.4 billion. We calculated this and other estimates using a $19 per participant per month PPPM pricing model. Our target market accounts for people in the United States who have one or more functional digestive diseases and have employer-sponsored health insurance. Our target users are low to medium risk populations with diagnosed digestive diseases or symptoms. This population is likely to be in the earlier stages of the disease journey and stand to benefit more from GKM's offerings. Our buyers are self-insured companies and health plans that stand to benefit from GKM's commitment to helping them reduce care costs, promote benefits utilization, and attract and retain employees. GastroKnowMi will generate revenue through two streams. We will market a free version of the app directly to users with a 2-week trial period. After the trial, users will be asked to pay $19 per month or $99 per year. We will also offer GKM to insured employees through our buyers using a software as a service PPPM pricing model. Employers, depending on number of employees, will pay between $10 and $50 PPPM. We will acquire users and support clients in ways that align with our goal of making digestive care more equitable. For instance, we will work with community health organizations and grant-sponsored government initiatives to provide GKM at no or low cost to at-risk and underinsured populations. Also, collaborating with our community and employer clients, we will conduct social media and on-the-ground outreach campaigns to acquire users, educate them, and collect and refine social determinants data. In our first 3 years, GKM will build an MVP and validate our value proposition while securing clients and pursuing critical user match from our diversity of populations. In year 3 and beyond, GKM will develop a clinical research offering that leverages our real-world data and single subject or N-of-1 experiment technology to improve clinical research insights, trial participant recruitment and retention, and participant diversity. Likewise, once interoperability rules are fully implemented, GKM plans to seed patient data to health system patient records and create new user experiences that facilitate provider-patient health monitoring and management. That's our presentation. Thank you so much.
That was like my buzzer went off. My hand was raised and amazing. Thank you guys so much. Liz or Suzy, does one of you want to jump in first? And you may want to stop sharing your screen just to kind of
we can see everything. That'd be great. I'm happy to. I'm unmuted already, so I'll go ahead and jump in. Thank you. One, what a fantastic solution to a problem that is a really big problem for many, many people. And two, for an excellent presentation. So I really have enjoyed it and learning about your solution. My main two questions. One is about accessibility. So you talked a bit about partnering with organizations to primarily lower the cost burden for users. But as a primarily self-use product app, I can imagine a lot of people that could benefit from the tool not having either the literacy or the other personal skills needed to be able to effectively use the app. So have you thought about accessibility in that sense? And then I'm just gonna, well, I'll just ask that, and then if I have time, I'll ask my second question.
Yeah, absolutely. Accessibility is quite important to us, and you know, we understand that a lot of the language can contain a lot of jargon, and you know, we're gonna go out of our way to make sure that the content that is delivered can be understood by our target population, which is low to medium risk populations between the ages of 22 to 49 and potentially older, but that's our target population. And yeah, we're gonna work with our community partners to understand the best ways to present this kind of technical information and just make it more layman's terms for people to be able to understand it. We will go through our MVP, through our first trial. We will kind of work with participants, work with people testing the product to get their feedback on what doesn't make sense, what can be improved in terms of how the content is presented to them. And in terms of just language and literacy, we'd also, like it was presented on the slide, also make it accessible in other languages as well.
Thank you. It might be useful to have examples of other apps that do a good job at the language issues and the sort of reader accessibility. Just to have in mind from the wireframe that you showed. I think, from a technical perspective, it looked great, but it looks like, there is definitely some room for improvement in terms of simplification of language and that sort of thing.
Absolutely.
So having models in mind would be a great step.
Yes, agreed.
So this is a really cool idea. And I think my big question is actually more about the science that underpins the app, right? Because anytime you're giving someone medical advice, there are ethical questions, there are liability questions. So I was wondering if you could provide a little bit more description of like the science itself, like you're taking people's personal medical information, you're compiling it, you're drawing conclusions from it, and then you're feeding that information back to people in a way that they're going to incorporate into their routines. So like, can you kind of just walk me through that in a bit more detail?
So would you like me to elaborate more on what these single subject trials are, these experiments, or more so just how we would approach, providing recommendations and insights on?
I think both, because it seems like those are sort of coupled parts of the app.
Mm-hmm.
Okay. Yeah, so these are single subject experiments that are common practice in the medical field. And yeah, they're a means of having a single person kind of run a controlled experiment, kind of defining when they introduce a variable that they seek to explore, like how it affects a particular symptom that they are curious about, right? And it's you have to kind of define the length of the control phase and the treatment phase, identify potential triggers and symptoms, and kind of doing this on your own without any kind of structured support or guidance is very difficult. And there are multiple ways of kind of designing for the length of each phase, whether it's control or treatment, different considerations of kind of introducing something and not introducing something. There's also a degree of randomizing when prompts to just respond whether you did something or not during each phase. It's all pretty complicated to do without a kind of an intelligent system supporting you. And but it helps the patient kind of determine quite confidently cause and effect, causality, in terms of something that they have a suspicion about that's affecting their symptoms. And that's what we want to bring to users, bring this technology to them and provide it in a layman's kind of understandable way that makes it easy for them to confidently assess whether or not something's affecting them and how.
Okay. And in your stakeholder engagement, like, have you already, or do you plan to work with medical doctors and experts who would typically prescribe this type of course of action to make sure that you're aligned with the best medical practices?
Yeah, absolutely. Everything is going to be based on the best medical practices and authorities in terms of just the design of the content, how it's delivered and phased. And yeah, according to the roadmap here, we said that we want to work with providers and health systems, but we see a more opportune time to do that once interoperability rules are fully implemented, allowing a more free and robust exchange of patient health data between third-party vendors such as GastroKnowMi and health systems, so we can better promote kind of the relationship and better facilitate experiences between patient and provider in this joint effort of monitoring and managing their symptoms and learning about them.
Can I just jump on that a minute? Because that was kind of my other question. So on your timeline or I don't remember what you called that slide, but roadmap, it seemed to me that the B2B market is probably an easier market than B2C. In other words, starting off by partnering with health systems, with providers, establishing the value in collecting this data for research and other experimental use, and then getting a sense of, how to embed this science that Suzy is talking about. I do think that, you establishing those partnerships with your health systems and with your medical providers first is going to really advantage you then when you go out directly into the consumer market. So obviously, there's a lot more behind this. You might have thought of different ways that relationship would play out. But to my mind, first creating those strong partnerships with medical professionals in using and selling the product will then give you the credibility that you're going to need to be able to then sell directly to your consumers. So I would just encourage you to consider that and work through that with, as you think about your business planning.
Yeah, and you bring up a great point about credibility, absolutely. But in terms of our mission to have GastroKnowMi more equitable and accessible to the populations that we're trying to target, we're trying to work through community organizations, through employers, to get them access to healthcare experiences that make it easy for them to manage and explore their health in ways that they haven't been able to do with just traditional models of interacting with gastroenterologists and dietitians. Often it costs too much, or they don't have enough time to seek these gastroenterologists, and those who have had the chance to go see them have had bad experiences with them in the sense that they weren't receiving the kind of sympathy and care and instruction, the guidance that they had hoped for. So we want to work with patients and people in the community and work through employers to get them access to something that they can kind of do on their own, because ultimately monitoring and managing your symptoms is something that you have to feel good about and competent enough to do on your own. And you can kind of bring that to your doctor, but these doctors can't do much in terms of kind of making sure that you're doing what you need to do, you're learning what you're needing to learn.
Thank you, Carlos, so much. We're a little bit over time on that.